So our first presenters today are Lisa, Wilton and my Duong, and you've got their whole CVs or their little bios in your, I think, are available online, but just in summary. So Lisa is an advanced nurse consultant working in the South Australian Office of the Chief Psychiatrist, and Mai is a general practitioner and GP Integration Officer at the Southern Adelaide Local Health Network. Welcome, and we're looking forward to your presentation.
We'll get going. So this is not us. This is a saying that we really like, resonates with us from Mental Health Foundation UK. You can't hear. Is that better? Yes, okay, all right. So we love this one, Mental Health Foundation from the UK. There is no health without mental health, no recovery without physical health. And of course we respect acknowledge the lands that we meet on today and acknowledge our lived experience. Cool. So, so this is our presentation around what we are trying to achieve. So we are trying to put together a mental health and shared care general practice, shared care model of care co-designed with lived experience, general practice and the mental health services, where we've got a team-based approach with shared vision and everyone being equal partners in this. And the model that provides clear expectations with guiding principles for all of us to aspire to is what we are after.
Thanks, Lisa. And then in this context, share care is really trying to address the fifth essential element in the Equally Well consensus statement that everybody knows by heart, I'm sure. So the fifth element is about care coordination and regional integration across health, mental health, and other services and sectors which enable a contributing life. So for the GPs in the room, this is really about how we collaborate together and work all together towards the same outcomes and vision. It's sort of a bit different to things like the obstetric share care model that we have in SA, where you have to, do specific training and be accredited to be part of the thing. This is for all of the GPs. So for a person and their regular GP and then the mental health team that's involved in their care, how do we work together and how do we have a clear idea of who does what, so there is no, doubling over of the things and no things that fall through the cracks, essentially. But before we delve into the model of care itself, we'll just quickly tell you about how this began.
So, yes, it's actually been a bit of a journey to getting here. So back in 2020, during COVID and the advent of Teams and Zoom, and we went, great, let's pull a group of people together who we can't get together, but we can all get together on Teams. So we pulled together a group with a focus on mental health, and we connected all the LHNs. At that time we connected DASA to the GP integration officers, which I learned about and was very fortunate to link with all of them, and all of them had a passion for mental health as well, which I was very fortunate around that as well. We had mental health service medical officers and a whole heap of clinicians and the PHNs, and we joined together and we aimed to find ways to facilitate mental health services and GPs working together to provide a holistic care and improving communication and ultimately outcomes for the people that we work with. So one of the first projects that we did was we collaborated and got together a mental health GP shared care webpage. We call it the one-stop shop for GPs, where it actually links to all mental health services within the state and or the state's mental health services and a few other bits on there. And so we got that off the ground, and then we thought, okay, well, let's provide some education. So we did a few focus groups. We pulled 4 focus groups together across regional and the metro areas, and we went jointly with GPs and mental health psychiatrists facilitating those workshops. And we were asked them their feedback or their identified priorities that lent themselves to educational opportunities. And then the second part of the focus group was around discussing questions that specifically related to shared care and educational needs. But what actually came out of that was that 3 out of 5 the responses said that they wanted the development of a mental health and general practice shared care model. So that's what we set about doing. Thought it was going to be easy, didn't we, Mai?
Yep.
Yeah, no, it's not.
It takes 6 months.
18 months later, we're still here. So, so we did some joint funding of the sessions that was provided through the Adelaide Primary Health Network and the Mental Health Strategy and Planning Branch, and in as well as looking at how we were going to pull this model of care together, we'd started doing the education sessions as well. So in 2023, we actually held 3 GP mental health education sessions, and we did 5 echo sessions that had an equally well focus. So that was the whole component of the echoes. And we really acknowledge that the mental health services require the support of holistic, specialised general practice care for people to be able to manage well and wholly. And then in January 2024, after some great deal of planning, we pulled together a workshop for GPs, mental health services and lived experience. And we looked at pulling together what the start of the model would look like. And this was attended by some lived experience. We had 16 mental health clinicians, 5 GPs, PHNs, and 8 other NGO and clinicians around there. During that year too, we held another 5 echo sessions and another 2 GP education sessions too. And we then spent lots of time collating the workshop information. We did it with post-it notes, so it took us forever. And then in May this year, we did another co-design workshop to test where we were at with all the information from the first model. We got a bit smart then and we used Mentimeter, so much easier to collate the information. And so in that one, in May, we had 7 lived experience people, 19 mental health clinicians, 10 GPs, another 5 clinicians in there. And we had made sure we had specific regional women's and children's hospital and Aboriginal consultation for that. And so that we make sure that the model covers all of those aspects. So we've got further consultations planned, and in SA we have got the unique opportunity of working with the clinical prioritisation criteria team. So the CPCs are being done all over Australia at the moment, but the first team nationally to be mapping mental health processes is our team here in South Australia, and the model of care is actually going to be referenced as part of those CPCs. And of course, all of the foundation of the model are the 6 essential elements from Equally Well are part of that. And it fosters the provision of holistic health care, looking at identifying physical health needs through assessment, monitoring and addressing those, appropriate service referrals and education, opportunities for lifestyle support interventions. And it's hoping or envisaging that establishing the shared care partnerships will ensure that people of all ages, including the children and older persons, receive appropriate referrals and support for their physical health needs. And noting that the importance of preventative care, especially for children and young people too.
So the aims of the model of care. So basically, as Lisa said, we've gone through that whole sort of co-design, crowdsourcing content of the document. And so the document really aims to do a few things. There's like sort of a high-level section about why do we need to do this. Then there's a section around guiding principles that have really come up at the focus groups about what is important in a person's care when there's the person and the regular GP and the mental health services involved, really. And then there's a third part that really has sort of step-by-step practical guides that show what good collaboration looks like at the specific touch points of a person's journey. Often in my GP integration role, I'm being asked, but what do GPs want? And so it was great to have the forums and the focus groups so that, you know, does this model suit general practice? Does this model suit mental health services? Does this model suit people seeking care? And then how do we work together to achieve that? So it's really a blueprint. Oh, excellent. I'll go really fast then. So that's really a blueprint for what good collaboration looks like. And so each of the LHNs will implement it in the way that fits their services, but it's really trying to have that common share goal so that we don't dispersing efforts trying to replicate things that are a bit same, but different. So those are like the big boxes that we're thinking of in terms of the patient journey, and we've mapped points of communication. And for guiding principles, we have like what are the expectations, how we go about this, how we evaluate this, and the long-term considerations as well. And then that's an example of the step-by-step practical guide for one of the steps that was identified before. So it's all based on the tools that we have now, like faxes, and then trying to make the most out of it.
And where we're going from here, of course, we need to consult more. We need to finish rewriting, and probably after consultation, rewriting, and then finally publish it. But what we really need to acknowledge is that all the mental health services and general practices have already got established individual processes around communication. And it's not about necessarily changing those, it's about building on those and doing what we can with what we've got, and then making sure we go a bit further. And recognising that while some LHNs have got established shared care and GP liaison positions with the teams, that's not the same practice across all of the LHNs, but it shouldn't be an impediment to actually establishing effective shared care communication and practice strategies. There we go.
Thank you. That was a whirlwind tour at the end. But that's all right.
1 minute.
That's fine.
God, I thought you said 5.
Does anyone have any questions for Lisa or Mai?
Great.
No? No? All right. So how much more time do you think this is going to take? Because you said at the beginning you thought it was all just going to be 6 months.
Yeah.
So how much more time, and what have you put aside now to actually get to the point where this project is completed before you might start evaluation phases?
So we're actually really close to getting it back out for consultation again, but we've recognised that we need to write a much more detailed executive summary. So once we get the executive summary out after Mad November is over, here in South Australia, then we are hoping that we'll actually get it out we'll do a soft consultation with all the people in the workshop and the people that have been involved in it along the way, and then once they've had a look at it, we'll do it again. But we actually have got a deadline. We have to have it finished by July.
Okay.
Next year.
So if you were working with someone else and they said, we want to do something similar, what kind of time frame would you now recommend to people that they're going to need if they were doing it, with your hindsight?
2 years? 3, maybe? It depends on how well you can get your collaborative groups together and how quick you can do that and how much support you actually can get, because Mai and I have taken the lead on this a lot. So we are writing this on top of what is usual everyday work. So if you can get project support with it, it will probably take a lot less time. But if you're having to do it on top of, I would give yourselves a couple of years.
Okay. Did anyone else have any other? Yes.
Hi, Susie.
No, I just wanted to ask what the rollout plan will be once you get there. Like, what does it look like? I mean, there are a lot of GP practices around. Like, how do you get this information to everyone to get that consensus around what shared care needs to look like?
Well, we're really fortunate because part of our consultation team has been our deputy chair of the RACGP. So we're really hoping to lean on friendships there to get some of this out. But yeah, we will engage with comms as well. Once we've actually got the model, then SA Health Comms will actually help us with the communications plan, and we'll be popping it out through there. It's really important to have that good communications plan. We're partnered with the PHNs as well, so getting it out through the PHNs, and they've been with us all along the journey too.
Thank you. Sorry, I was just thinking my tea problems. Any other questions?
missed it, but can you fit this in with my health record at all? Because my health record is so important in terms of communicating and using the same plan, maybe.
It is in our step processes, and the My Health record goes in there. I mean, we have got in the things that we've done, we've got our long-term considerations in there, because this will always be sort of like a working document as we go through, and as we know, we don't have secure messaging here in South Australia, so it's about what we've got now, and we've certainly got My Health record in sites in the plan. But long term, we would love to have a shared record, which, you know, I'll be retired before that happens.
Thank you.
Thank you.
No.